0203 515 1035. My name is Deep RAJAH. This is Dilsa Radio. Now, this is the time where doctors stop treating. No, they don't go on strike. They just cannot help but listen to me. Nurses stop working. Porters stop cleaning. Hospitals completely stop. Why? Because it's Medical Monday. It's that time again where the advice that is given and the advice that is listened to makes the difference. It's your Medical Monday. With me in the studio are my very good friends from Komao Medical Group. Dr. Aman Sharma, very good afternoon to you.
Hello, good afternoon, Deep.
Thank you very much for coming back onto Let's Talk and Medical Monday. I want to pick up from where we left off, and I'm going to start with what we did or what we discussed last week, because there have been so many people asking me about this, and that is aftermath, aftercare, understanding what the hell that is. And I say hell because some people go, oh my gosh, the pain that I've gone through after having that operation, after having that chemotherapy, after having that Botox, it's really, really bad. And there's nobody there to pick up the phone to. What can you say to them?
Aftercare is very important because, after a procedure or after you see your doctor, a lot of patients, they've had their treatment, but when they leave the room, they have a lot of questions, that they want to ask. They have a lot of anxiety that needs to be addressed. And because, they've left with all that information, or they've gone home with this procedure done, and they have to look after themselves. They have to, that responsibility in the consultation is now, on their shoulders. So it's a lot to wear. It is quite stressful. But that's, where we can help. We're there on telephone line. Follow-up appointments. That's, is aftercare is extremely important.
Do you think that the aftercare Komao Medical Group could provide is, how shall I put this, more one-to-one on a basis? Now, let me give you an example and see if we can do this. Gentleman or a lady has hair reformation.
Yeah.
Maybe even Botox. Now, they go home, and after, say, 2 weeks, they're getting a bit of pain in the head, or a bit of a pain in the jaw, right? It does happen because the body doesn't like to accept things in 1 minute.
It does happen, yeah.
Right. What can you do to make sure they do not feel left? Just not like that. What can you do?
So, in these kind of situations, so let's say, for instance, with the hair transplant operation, the patient will experience, I'm not going to lie, a lot of discomfort the first 2 days, first 3 days. So in this kind of situation, I want to make sure that patient knows that I'm available to, they can call me, they can send me messages, we can book a clinic appointment for them to come so I can see the operations, how, if there's any scarring, any inflammation. So I'm available. So come, we can prescribe extra medication. Usually we have a set regime for the patient, like to apply a steroid cream at the back of their head to reduce the inflammation, and we give some painkillers. But if that's not working, then we can always increase the dose, or if the patient is not in any pain at all, then we can even increase the dose. So we can tailor the aftercare for that patient and how he's responding to the treatment. We always have a follow-up appointment with any patient we do in our clinic. It's not like you go abroad to Turkey, you do your operation, and you never see the doctor again. Here we make sure we're seeing you regularly, 2 weeks, so we can even see you earlier than that. So
can a patient call you when they want? I agree, it's a great idea every 1 week, 2 weeks, there's no argument. But sometimes some patients can get a bit sensitive when it comes to the head operation or something, and something goes wrong, or not goes wrong, a little bit of pain or something. The 2 weeks hasn't elapsed. Can they call you in between and say, look, I need to see you? Yeah,
absolutely. They can do that without a doubt. That's something that we can offer at Komao. So it's quite unique. I don't know if many clinics do that, but we do offer that. They can call me, especially for all our hair transplant Botox patients. They can call me.
Okay, look, we're going to continue after a quick commercial break. But what we're going to look into as well with you guys at Komao is what kind of services you offer when it comes to follow-up treatment. When you look at private GPs, sometimes we were talking about prescriptions and stuff. Can we sort that out at your surgery? And I think the most important thing that we have to look at today as well is the age of the patient. If the patient, for example, let's say is going for Botox, is there an age restriction? If the patient is going for hair loss, Is there an age restriction? And, you know, I ask because as we're living longer, more and more of us want to still look 50 when we're 80.
Yeah, of course. Yeah.
So can we really do that in terms of, you know, our facial features and our Botox and our hair? If you want to speak to him, by the way, 0203 515 1035. I'm with Dr. Aman Sharma, who is from our very good friends at the Komao Medical Centre. What I want to know from you, my lovely friends and listeners, have you had hair transplants? Have you had Botox? Have you had perhaps a private GP? And if you have had all these, or even one of these things, I would like to know your experience and what you would like to see from somebody like Komao Medical Group and Dr. Aman Sharma, so that it makes your life a lot easier. You see, at Dil Se Radio and Medical Monday, we're not just here to throw hospital advice. We want your advice so that we can make this a two-way street. My name is Deep Rajah. This is Dil Se Radio. Very good afternoon to you.
The gold rate on Dil